Hello, my fan page supporter. I am Dr. Mohammad Sujudi, MSCOO7 version. Welcome to medical science class. As a student of medical science, I want to take clever every branch of science. What kind of things they do, that is bad, that is normal, that is science, that is good work, that is not. As a Muslim, Allah is the one and only creator, except Allah, all creation, last and best messenger Muhammad. The I like the Allah Muhammad Rasulullah. ওই আমার ইয়া আলিফ লাম লাম হা ইয়া আল্লাহ শাফি আল্লাহ মাফি আল্লাহ কাফি আনার আব্দুল মোহাম্মদ শরীফ শাফি আনার আব্দুল মোহাম্মদ শরীফ মাফি আনার আব্দুল শরীফ কাফি আনার আব্দুল মোহাম্মদ শরীফ শাফি আনার আব্দুল মোহাম্মদ শরীফ শাফি Today my friend is supported in case of my organization 8 day in case of Bangladesh time Shabe Barat. Those are my friends and supporter. Try to help you by your capability, not beyond your capability. Already I also given and 100 taka 10 people 100 taka by your capability, not beyond your capability. Those are my friends and supporter all over the world. Now 8 mean help, and in case of abbreviation ADE, Allah Deen Islam. And as a religious, that is my religious right, spread my religion peacefully all over the world, not harmful. La ilaha illallah Muhammad Rasulullah. Now medical science class. Medical science class. What is science? Science is anything, any matter, any event, any problem, any occurrence can solve by logic, document, database, mathematical calculation, with proof and with experiment. That is science. What is medical science? Medical science is the branch of science described, elaborated about creation like Homo sapiens. We describe, elaborated about some common disease and treatment protocol. And now my friend is supporter. If what is the mechanism? Already we see that. What is how you know that your body function work properly and good. Your body function workly good and properly perfect. In case of already for that indicator, body indicator, or see your temperature. Already said remain normal range or not. In case of adult 97 to 98 degree Fahrenheit. Pulse equal about 70 beats per minute. Respiratory rate 16 to 18 breath per minute. Bowel movement 1 minute 1 to 2. Bowel guard movement, bowel sound in 1 minute 1 to 2. And urination, intake output chart remain normal, and stool passing and not more than per day, not more than 2 times. Equal more or less 1 to 2. Then in case of sign of inflammation, anything, redness, raise of temperature, swelling, history of trauma, and history of injury present or not. That is your body mark indicator. And any ache mean pain, any pain, head pain, eye pain, ear pain, nose pain, throat pain, and body pain present or not. Now coughing, in case of lung, coughing present or not. And respiratory rate increase or decrease, you see that by your body indicator functional growth. In eye power, near vision, distal vision remain normal. In case of nose, smelling remain good. In case of nose, in case of taste, salt, bitter, sugar, you feel better when you take that salt, bitter, sweet, and sour. Top, you feel. That is your body and function remain normal. That is the indicator. And as long as possible, you try to remain good, healthy wise, and secure. As long as possible, you remain without drug. And in case of teeth, teeth or toothache present or not. একটু পরে আপু 5 মিনিট পরে toothache present or not, and toothache, thoughtache or thought pain, tooth pain present or not, and nasal congestion, running nose present or not. That is the indicator of your body remain, and in case of eye redness or present or not, that is the indicator your body remain good or bad or ugly. Already azan given. Allahu Akbar, Allahu Akbar, Allahu Akbar, Allahu Akbar, ashhadu la ilaha illallah, ashhadu la ilaha illallah, ashhadu anna Muhammadar Rasulullah, ashhadu anna Oh, that is the body indicator. Body function remain good or not. Those are my patient, and you see that if anything wrong, go to the doctor, and then in case of severe term and severe body condition, health condition, you go to the hospital. What is this? If you pass below 60, if you pass below 60 or above 100, respiratory rate below respiration below 10 or above 25 or 30, above 25, your pass below 60, your pass below 50 and above 120, respiratory rate below 10, and if increase below above 30. If you see that sign symptom, you take to patient to hospitalize. Direct go to the hospital. Two symptom: pulse equal above 120 and below 50. Pulse below 50. Respiratory rate below 10, above 30. That is the symptom marker. If you see that symptom marker, patient as soon as possible go to the hospital, and initiative step will take to cure that. That is the severe condition, and by pulse and in case of blood pressure, BP, if diastolic pressure, if go to the 100, is diastolic pressure or below pressure equal above 120, and systolic pressure equal above 200, then go to the hospital. In case of blood pressure, if blood pressure patient diastolic pressure below pressure equal above 120 and systolic pressure equal above 200, then patient go to the hospital. In that sign symptom, if you see, patient hospital is the patient. Already we see and revise: pulse below 50, above 120, respiratory rate below 10, above equal above 30, and blood pressure below 100, diastolic pressure 120, systolic pressure to equal above 200. That is the dangerous sign. Patient go to the hospital. Again, pulse below 50, equal below 50 and above 120, adult pulse. Respiratory rate below 10, above 30 in case of adult. In case of children, that is I say the adult patient. And blood pressure below diastolic pressure 100 equal above 120, systolic pressure below pressure or diastolic pressure equal above 120 and systolic pressure equal above 200. Hospitalize the patient as soon as possible if you see that sign. Those are my patient. Those are my patient. If you see that sign, danger sign, hospitalize the patient. Thank you very much, my pen supporter. And temperature, if temperature go to the 105, equal above 105, hospitalize the patient. Patient go to the patient, and temperature equal above 100 degree, 105 degree Fahrenheit, hospitalize the patient. Already pulse below 50 or equal below 50 or pulse and अथवा above or above equal above 120. In case of blood pressure, respiratory rate below 10, above 100, above 30. In case of blood pressure, diastolic pressure equal above 120, systolic pressure equal above 200, and temperature equal above 150 degree Fahrenheit. If that is the severe condition, if see that sign symptom, patient directly go to the hospital. Thank you very much, my friend. Today is enough from medical science class.